Why do some children suffer more health complications? Why do some lose the babies at tender age? What are these monsters in terms of diseases? And why do most parents encounter a lot of children health emergencies every now and then? Welcome to Healthy Lifestyle Channel. Children are especially vulnerable to certain illnesses due to their developing immune systems and close contact with peers in schools, playgrounds, and daycare settings. Understanding the most common diseases that affect children helps parents, teachers, and caregivers prevent, recognize, and respond to these illnesses early. This video highlights the top 11 diseases that mainly affect children, including their causes, symptoms, and preventive measures, empowering families to protect their children's health. Number 1. Respiratory infections. Respiratory infections are among the leading causes of illness and death in children, especially under 5 years old. Common examples include pneumonia, bronchiolitis, often caused by RSV, and influenza, which can lead to breathing difficulties, fever, and poor feeding. Good nutrition, vaccination, hand hygiene, and prompt medical care are key to prevention and reducing severe outcomes. Children are more prone to respiratory infections because their immune systems are still developing and they often have close contact with peers in schools or daycare, making it easier for germs to spread.
Number 2. Diarrheal diseases. Diarrheal diseases are a major cause of illness and death in children, particularly in developing countries due to rapid dehydration. They are often caused by infections like rotavirus, bacteria, or parasites, and are worsened by poor sanitation and unsafe drinking water. Prevention relies on safe water, good hygiene, breastfeeding, and vaccines, while treatment focuses on oral rehydration and zinc supplements. They often get diarrheal diseases because their immune defenses are weaker, and they are more exposed to germs through unsafe water, food, and frequent hand-to-mouth behaviors.
Number 3. Malaria. Malaria is a life-threatening disease in children caused by Plasmodium parasites transmitted through the bite of infected Anopheles mosquitoes. Children under 5 are especially vulnerable because they have not yet developed partial immunity, making severe complications like anemia, seizures, or coma more common. Particularly dangerous in children under 5 in endemic regions like Africa, parts of Asia, Latin America. Prevention with insecticide-treated bed nets, indoor spraying, and prompt treatment with anti-malarial medicines are essential to protect children. Children are highly affected by malaria because their immune systems are not fully developed, and they are more exposed to mosquito bites while sleeping or playing in endemic areas.
Number 4. Measles. Measles is a highly contagious viral infection that mainly affects children and spreads through droplets from coughing or sneezing. It causes symptoms like high fever, cough, runny nose, red eyes, and a characteristic rash, but can also lead to serious complications such as pneumonia, encephalitis, and even death. Vaccination is the most effective way to prevent measles and protect children from outbreaks. They are more likely to get measles because they lack natural immunity if unvaccinated, and the virus spreads easily in crowded settings like schools and playgrounds. If you find this video interesting and useful, please like and subscribe as we proceed.
Number 5. Whooping cough, pertussis. Whooping cough, pertussis, is a bacterial infection caused by Bordetella pertussis that leads to severe, prolonged coughing fits, often ending with a whooping sound when the child breathes in. It is especially dangerous in infants, who can develop complications like pneumonia, seizures, or even death. Vaccination with the DTaP-DTWP vaccine is the best protection against pertussis in children. Children contract whooping cough because the bacteria spreads easily through droplets when an infected person coughs or sneezes, and their underdeveloped immunity makes them more susceptible.
Number 6. Hand, foot, and mouth disease. HFMD. Hand, foot, and mouth disease, HFMD, is a common viral infection in children caused by Coxsackie virus or other enteroviruses. It leads to fever, mouth sores, and a rash on the hands, feet, and sometimes buttocks, and is usually mild but can occasionally cause complications. The disease spreads through close contact, respiratory droplets, or contaminated surfaces. So good hygiene and disinfecting toys and surfaces help prevent infection. Children often contract HFMD because they frequently touch contaminated surfaces, share toys, or have close contact with infected peers, and their immune systems are still developing.
Number 7. Meningitis. Meningitis is an inflammation of the protective membranes, meninges, around the brain and spinal cord, caused by bacterial, viral, or rarely fungal infections. In children, it can cause fever, headache, stiff neck, vomiting, and, in severe cases, seizures or death if not treated promptly. Vaccination, early diagnosis, and timely treatment with antibiotics or supportive care are crucial to prevent serious complications. Children are more vulnerable to meningitis because their immune systems are still developing, and they can easily contract it through respiratory droplets or close contact with infected individuals.
Number 8. Otitis media, or middle ear infection. Otitis media, or middle ear infection, is common in children due to their shorter and more horizontal eustachian tubes, which allow fluid and bacteria to accumulate. It often causes ear pain, fever, irritability, and sometimes temporary hearing loss. Prompt medical treatment with pain relief, and sometimes antibiotics, along with preventive measures like vaccinations and avoiding smoke exposure, helps reduce complications. Children often get otitis media because fluid can easily build up in their shorter eustachian tubes, especially after colds or respiratory infections, and their developing immune systems make them more susceptible.
Number 9. Polio. Polio is a viral disease that primarily affects children under 5 and can cause paralysis by attacking the nervous system. It spreads through contaminated water, food, or direct contact with an infected person. Vaccination is the most effective way to prevent polio and has nearly eradicated the disease worldwide. Children are more prone to polio because they are more likely to ingest the virus from contaminated water or food, and their immune systems are not fully developed to fight it off.
Number 10. Nutritional deficiency disease. Nutritional deficiency diseases in children occur when their diet lacks essential vitamins, minerals, or protein, leading to poor growth and development. Common examples include rickets, vitamin D deficiency, iron deficiency anemia, and protein energy malnutrition like kwashiorkor or marasmus. Prevention involves a balanced diet, supplementation when needed, and education on proper nutrition to support healthy growth. Children are more affected by nutritional deficiency diseases because their growing bodies require higher amounts of nutrients, and inadequate diets, poor feeding practices, or food insecurity make them especially vulnerable.
Finally, number 11. Sepsis. Sepsis in children is a life-threatening condition that occurs when the body's response to an infection causes widespread inflammation, potentially leading to organ failure. It can result from bacterial, viral, or fungal infections, and symptoms include high fever, rapid heartbeat, difficulty breathing, and lethargy. Early recognition, prompt medical treatment with antibiotics or antifungals, and supportive care are critical to improving survival and preventing long-term complications. Children are more susceptible to sepsis because their immune systems are still developing, making it easier for infections from bacteria, viruses, or fungi to trigger a severe, body-wide response.
Before we call it a day, here's a concise medical reference-style summary of the top 11 diseases that mainly affect children, including causes, symptoms, and preventive measures. 1. Respiratory infections. Causes: viruses, RSV, influenza, or bacteria, Streptococcus pneumonia. Symptoms: cough, fever, difficulty breathing, runny nose. Prevention: vaccination, flu, pneumococcal, hand hygiene, avoiding sick contacts. 1. Diarrheal diseases. Causes: rotavirus, bacteria, E. coli, cholera, parasites. Symptoms: frequent watery stools, dehydration, vomiting, fever. Prevention: safe water, proper sanitation, hand washing, oral vaccines, breastfeeding.
1. Malaria. Causes: Plasmodium parasites transmitted by Anopheles mosquitoes. Symptoms: fever, chills, anemia, seizures, lethargy. Prevention: insecticide-treated bed nets, indoor spraying, prompt anti-malarial treatment. 1. Measles causes: measles virus, transmitted via droplets. Symptoms: fever, cough, runny nose, red eyes, rash, potential complications, pneumonia, encephalitis. Prevention: MMR vaccination, avoiding contact with infected individuals.
1. Whooping cough, pertussis. Causes: Bordetella pertussis bacteria. Symptoms: severe coughing fits with whoop, vomiting, apnea in infants. Prevention: DTaP vaccination, early antibiotic treatment, limiting exposure to infected people. 1. Hand, foot, and mouth disease, HFMD. Causes: Coxsackie virus or other enteroviruses. Symptoms: fever, mouth sores, rash on hands, feet, and buttocks. Prevention: hand washing, disinfecting toys and surfaces, avoiding close contact with infected children.
1. Meningitis. Causes: bacteria, Neisseria meningitidis, Streptococcus pneumoniae, viruses, rarely fungi. Symptoms: fever, headache, stiff neck, vomiting, seizures. Prevention: vaccination, meningococcal, pneumococcal, Hib, early treatment of infections. 1. Otitis media, ear infections. Causes: bacterial or viral infections, fluid buildup in the middle ear. Symptoms: ear pain, fever, irritability, hearing loss. Prevention: vaccination, avoiding smoke exposure, prompt treatment of colds.
1. Polio causes: poliovirus, transmitted via contaminated water or food. Symptoms: fever, fatigue, paralysis, sometimes permanent. Prevention: polio vaccination, OPV, IPV, hygiene measures. 1. Nutritional deficiency diseases. Causes: lack of essential nutrients, iron, vitamin D, protein. Symptoms: growth retardation, rickets, anemia, weakness, delayed development. Prevention: balanced diet, supplementation, nutrition education. 1. Sepsis. Causes: bacterial, viral, or fungal infections leading to systemic inflammatory response. Symptoms: fever, rapid heartbeat, breathing difficulty, lethargy, organ dysfunction. Prevention: early treatment of infections, vaccination, prompt medical care.
Thank you so much for visiting this channel and for watching. Don't forget to like and subscribe. Bye.